It is my distinct pleasure to nominate Julie Geddes for the B.E.S.T Award for Changing Attitudes for 2011. Julie's passion truly is prevention. This passion is not limited to only when she is at work, but also on her free time as well. She sees every time she meets someone new as an opportunity to promote suicide prevention. And what makes Julie truly special is in times of crisis. Julie has become engaged with schools that have experienced the tragedy of suicide, and her passion, dedication, and professionalism have helped them deal with the tragic event, but also to build constructive responses to ensure that these tragic events are not repeated. Her commitment and passion really make a difference in changing the attitudes of Oklahomans.
Central Oklahoma is most pleased to nominate Cathy for this award. If you ever want to experience changing attitudes, I suggest that you have a conversation with Cathy, who is a recovery support specialist for us. If you are part of a barrier between a person receiving appropriate services and Cathy is involved in that, you will understand the notion of changing attitudes. For Cathy and her advocacy is a force to be reckoned with.
Faith came to us in 2011, in March. She was hired as a recovery support specialist. Over the time, Faith has shared a lot about her recovery. She's talked about being homeless. She's talked about having lost her license as a clinical social worker. Since then, she's been just an absolute jewel in our facility. She has regained her license. She's now a counselor. She has actually taken the lead in a great many things. There's a scripture in Hebrews that says, faith is the substance of things hoped for. That talks about the verb, but this is just as fitting for the person. I'm pleased to nominate Faith.
Diane is always advocating for the individuals we serve. She goes into the community to get donations for various consumer projects, educating community leaders about mental illness and those that we serve. Most notably, over the last year, some consumers wanted GED testing. She had great difficulty finding a provider to provide that testing because of the fear and stigma. She took it on as her personal goal to find a tester. And starting last May, we were starting the test, and we have 3 consumers who have gotten their GED. Thank you, Diane.
David, he came to our agency already in retirement, and we love his attitude. He's a go-getter. He is always jumping in, trying to see how we can streamline services and service people much better, much quicker. He's always got a positive attitude, willing to train, retrain, help, and assist. And we thank him for that because he helps all of the staff that come into contact with him.
Central Oklahoma is pleased to nominate Sharon Steele for this award. She is a PCA in the Psychiatric Social Rehab Program. In a very quiet and industrious way, she creates a wonderful, welcoming environment and a friendly environment for all of the persons served in the PSR program. One will see her at sunrise, getting a van prepared to go out and pick consumers up to come to this program during the day. And she is admired for her work ethic and her sensitivity to other individuals that we serve.
Marty Clifton, she is awesome. She definitely deserves this award. She has over 30 years of service for our agency, and she advocates for the consumers, and she assures that they get the appointments they need and directs traffic, so to speak, for our Duncan satellite location. And she has been extremely helpful and like a historian for our agency, and we love her.
Central Oklahoma is pleased to nominate Billie for this award. Billie is an administrative assistant with our Child and Family Services, and she is the hub around which the wheel of a number of programs revolve. Her central role means that she has contact with all of the children and youth and caregivers of those consumers. And she is friendly with them, she knows them by name, and she ensures that they have access to all of the needed services.
Gene Burns is one of those rare individuals that I've had the pleasure of knowing for over 20 years. His knowledge, his compassion, his warm smile in greeting customers is one of those rare qualities that reflects his genuine compassion when it comes to employees. And he's always ready to pitch in and help the staff as well as customers with their needs. Thank you, Gene. You're an example that all the staff can be proud of.
This nomination is for Julie Jacobs, Human Resources Manager for Oklahoma Forensic Center and Rose Rock Recovery Center. She works for both of our facilities and provides outstanding service in all aspects of human resources. The staff have really become to depend on her for advice on not only payroll, but benefits, insurance, and any other questions they may have. She's also very ethical and has done an outstanding job with helping with hiring, firing, and disciplines. We are glad to nominate her for this award.
Angela is a fine ambassador for TCBH. She works at our front door, so for most people she is the very first contact that they have with us. She hasn't been with us too long, but from day one she has been a friendly, warm and welcoming and very professional person to have at our front door. She works with all kinds of people, from consumers to family members, the public, law enforcement, and she's been doing a wonderful job with everybody. She has recovery in her heart, and she wants only the very best for our consumers.
Pam truly is an exceptional person, and as somebody who has been the benefactor of her enthusiasm for customer service and the quality which she strives to deliver, I'm one very impressed person. Pam brings a spirit of innovation, a spirit of getting the job done, and certainly is somebody who's willing to propose unique opportunities to meet what are often very difficult challenges as it relates to HR management issues. Pam truly strives to be a customer service professional, and she makes our job much, much easier.
Central Oklahoma nominated Tina Stiefmiller and the Children's Wraparound program, all of the members of that team, because of their work together in developing an electronic method of monitoring a problem between engaging families and implementing a wraparound plan. With this electronic method, they were able to dramatically reduce the time that it took to start providing services. And for this reason, we wanted to nominate Tina and the wraparound team itself.
Tekla and Sharon definitely deserve this award. They love to see how much money they can save the agency. They have saved the agency hundreds of thousands of dollars over time, being able to advocate for our consumers, get the medications that they need, and being very creative about work simplification and saving money, and assuring that the consumers get their medications on time, and helping out with all of the outpatient services as needed.
Griffin Memorial Hospital is pleased to nominate Rene Klein. She serves as the performance improvement nurse for the hospital. But the work that she does cuts across all the programs and across all disciplines. Her knowledge, experience, and commitment to positive change and quality of care is evident in all that she does. When she talks about quality of care, we all pay attention, and she provides us with a wonderful resource and depth of information to guide our decision making.
The Award of Innovation, Quality Improvement, and Productivity Enhancement is from our Improvement Safety Committee. These group of individuals went together, looked at a problem that we had going on, looked at improving their productivity, safety, increasing numbers of work, improving the process. Of course, they've got the Quality Crown Award of Excellence that was awarded by Governor Mary Fallin at the Quality Team Day. They did an excellent role in improving the services that we provide.
Central Oklahoma is most pleased to nominate the entire medical records staff. This staff is composed of Ray Camp, Becky Steelman, Susan Adwell, and Leslie Dehart. Because of them, Central Oklahoma has not used a paper chart since the summer of 2010. there are a number of innovations that this small staff, but very hardworking and very creative staff, have done and has radically transformed how we do business at the Mental Health Center.
David is a very deserving candidate for this award. He has been exemplary over the last 12 months, and initiating programs are going to be very helpful to our providers. In his role with Decision Support Services, David has implemented changes in our processes related to the consolidated claims processing system that have allowed our providers to bill Medicaid and recoup thousands of dollars. He's also been instrumental in holding webinars that have provided technical assistance to those providers, and has also been innovative in developing new processes related to TANF. All of these innovative steps have made a difference for our providers and therefore made a difference to the thousands of Oklahomans who rely upon our services.
I am pleased to nominate Heath Holt for the Best Good Samaritan Award for 2011. Everyone who meets Heath knows that he has a tremendous amount of energy and passion. He exhibits this every day as he advocates for the consumers in our system. But his passion also extends to the numerous charitable organizations and causes that he works with when he is not at work. He has volunteered his time with the Homeless Alliance in helping homeless individuals to get back on their feet. He volunteers his time with Planned Parenthood, and he has created a nonprofit organization called Oklahoma City Youth United, which helps members of the gay, lesbian, bisexual, and transgender community. Heath really is a good Samaritan. Thank you.
Connie has been an employee for Carlisle Community Mental Health Center for 15 years. She is one of the most considerate people that I have known. She has done a couple of different roles for the agency, being as at our front desk and now in our finance department. She strives to put a smile on everyone's face on a daily basis, and she has worked with the families for our Angel Ministries to allow access to consumers and staff to the food pantries and the program that they have going there.
Central Oklahoma is most pleased to nominate Stella for this award. In her work, Stella encounters families and their needs revolving around food and nutrition. In her day job, she connects them to food stamp programs and to food pantries, but often the need is beyond those established resources. Stella, on her own time, connected with the local Panera Bread to get bread and pastries and so forth that they were not using, and to on her Saturdays collect that and take it to the families that we serve through the children's program.
Mary is one of those individuals that Northwest Oklahoma is blessed to have. She goes out, provides services to our consumers on any time they need. She is always donating voluntary money, items that they need. She organizes our Christmas gifts and exchange and party. She is just an awesome individual that has really been an asset for the consumers and the staff at Northwest Center Behavioral Health. Thank you, Mary.
During the snowstorm last winter, 2 folks in security went well beyond and above the call of duty. Brad and Shawn. They worked as a tag team. They pulled out vehicles, dug people out of the snow. But most specifically, when an employee needed medication who was on duty, they were not able to get to his house. The roads were impassable. They walked 2 miles in the snow, 24 inches of snow, and got that medicine for the employee and brought it back. These are truly good Samaritans.
Bill McCutcheon is the Native American Spiritual Advisor for Rose Rock Recovery Center. He's been working with us for 4 years and has provided the clients with not only Native American spiritual advice, but he also has helped us build a sweat lodge on the property and comes to our facility and runs sweat lodge ceremonies every other month. He also comes every other week and provides a medicine wheel class for the clients. The clients are quite enamored with his style. He's quite gracious, non-judgmental, and nurturing with them in his process.
Connie has been with the agency for more than 30 years. She has it displays excellent customer service. to the consumers as well as the staff. She also works as an LPC for the facility and strives every day to do something that enhances the lives of those that we serve.
Central Oklahoma Community Mental Health Center is pleased to select Dr. Ken Gray for the Employee of the Year. Dr. Gray is recognized by his colleagues and recognized by the persons that he served as someone who is sensitive, able to engage people, and work with them towards their recovery. He is a flexible individual with years of experience and sets an example of a work ethic for all of us to admire and emulate.
Jennifer recently helped us start a crisis unit at Children's Recovery Center. She was very diligent in her work. She is the kind of person that immediately pulls in her staff and makes them feel part of the team. I feel that she exemplifies the fundamental principles of recovery. Jennifer has a plaque in her office. It's from Harry S. Truman, and it says it's amazing what can be accomplished when you don't care who gets the credit. When I told Jennifer about the award, she actually tried to give it to her team. So I'm pleased to nominate Jennifer Dale for Employee of the Year.
Griffin Memorial Hospital is honored to select Alan Jones for its Employee of the Year. Alan has only been an employee for a short amount of time, but he has been most impressive in his energy and his customer service focus. He's involved himself in all sorts of aspects of the hospital in terms of the sanctuary core team, employee council, and consumer council.
Mandy Purdue was nominated for Employee of the Year and received this award for our agency because she goes above and beyond. We feel like she was one of our first choices for Employee of the Year. For all that she does, she's very compassionate about the consumers that she serves. She goes above and beyond in the fact of helping and staying late. She was able to step in and save someone's life, and we think that's the ultimate mission that we have here with our agency. So we're very thankful to have her.
Cindy, wow, she is the dedicated employee that whatever's asked of her, she does. She may cover in Diamond, which is 2 hours away from the main facility or work site, to Guthrie, 2 hours the opposite direction. Does it with a smile on her face and what's next. She is consumer driven. She has over 30 years with us. She is above and beyond what is asked of a dedicated employee, and she is our Employee of the Year.
Compassion, commitment, dedication. That's our Quincy Brown. Over the last year, Quincy has logged nearly 10,000 miles of accident-free travel, taking our consumers all around this great state. In addition, he volunteers when things need to get done throughout the facility with all of the staff, as well as being there to assist customers on the unit. We're deeply proud of Quincy and the example that he sets for all staff. Thank you, Quincy. We appreciate you.
The OFC staff elected 2 fine PCAs for Employee of the Year. Eugene and Cindy are a tag team, a husband and wife team, plus they're both at work all the time, helping the patients, very positive attitudes. Eugene has been an employee for over 30 years, Cindy almost as long. You can always count on them being here, being available, and ready to assist at any time.
Vicki Kelly is our LPN at the center, and she's been an outstanding employee in many ways. She is always utmost in efficiency and dependability and reliability, and she makes sure that the client's needs are taken care of as far as medications, their safety, and that they have full explanation of how medications interact with their daily lives or any physical symptoms that they're having. We're very proud of Vicki. She's been an outstanding employee, and we wish her luck in the nomination.
I am so very happy that Dustin Sponsler is able to be the TCBH Employee of the Year. Dustin is an absolute rock star. That's not an exaggeration. He actually plays in a band and he is a rock star, but he also is that at TCBH. Dustin has, over the years, as he's been here a really long time, helped with almost every kind of job that there is to be done at TCBH. He goes way above and beyond his own job description with his own department. What's most important about Dustin is, as much as he is wonderful with our staff and all the public people that we interact with, he's especially wonderful with our consumers. Gentle and patient, does a great job.
It is my distinct pleasure to nominate Jackie Shipp as the Central Office Employee of the Year. Jackie is an incredibly hard worker whose commitment and dedication to our mission sets a great example for all of us. What I think really sets Jackie apart is her special attitude. She has this wonderful can-do spirit that is infectious and helps all of us get the job done. Jackie has a tremendous passion for serving those in need and is able to balance developing a larger system of care, as evidenced by her development of the Behavioral Health Development Team, as well as working for local systems of care. Jackie is truly the best. Thank you, Jackie, for all that you do.
Jessica, as the leader of our prevention division, really exemplifies building excellent services together. This area is critical for our state, and Jessica is helping bring more and more attention to the need for prevention. She doesn't just focus on the issue of prevention of substance abuse, although we lead the nation in some of those efforts. Jessica is also helping us work on mental health promotion as well as the prevention of mental illness. Another reason Jessica is an excellent candidate for this award is other state agencies and the general public look to her as one of our state's leaders overall in prevention. Jessica is helping us do what we need to do for Oklahomans.
What can you say about Debbie? She is full of energy. She is a perfectionist. She takes on any challenge and she does it with a smile. She's tremendously efficient. She has agreed to take on both Carl Albert Community Mental Health Center and Taliaferro Community Mental Health Center this year, and she has done it with grace and style. The employees have all embraced her as she has worked her way through problem solving the issues with Avatar, with billing, with staffing, so that both of them can run as efficient and effective as possible. Debbie exemplifies a best employee, so thank you so much for your service.
Jackie exemplifies the best in ODMHSAS staff. She's taken on the dual role of overseeing our children and family system as well as overseeing our community-based system for our adults. She looks at the whole system as evidenced by the development of the statewide behavioral health team, and at the same time you can see that she balances the whole system with the local systems of care and the key support she plays in the development of those programs. In addition to her expertise in writing for grants, Jackie's brought therapeutic options to our state this year. We know this is going to make a huge difference in the consumers we serve and providing better, more trauma-informed care. Jackie's done a great job for the department.
Central Oklahoma is honored to nominate Dr. Bennett for this award because of his years of dedicated service to serving individuals, his years of service with the program of assertive community treatment at the Mental Health Center, his experience, knowledge, and commitment to recovery.
Dr. Rathgeber has been a board-certified psychiatrist for Northwest Center Behavioral Health with over 25 years. His passion, his dedication to work in rural Oklahoma and cover 24% of the state has been a true asset. I mean, we call him the best in the West, and he'll be a legend for many years with us. We will greatly miss him.
Griffin Memorial Hospital is honored to nominate Steve for this award because of his work in setting up a computer lab for the person served at the hospital and for his absolute energy and commitment and dedication to recovery. He works with individuals served by the hospital in a very sensitive, caring, and compassionate way.